Hello everyone, I'm glad to introduce myself. I'm R. Bhavani, pursuing final year BPT in SNS College of Physiotherapy. Today I'm here to present a case study. I recently went for my clinical posting to Kumaran Medical Center where I encountered a patient. Today I'm going to share my case study about that patient. So first sharing about the demographic data. Name of the patient was Mr. Raghunathan. Age of the patient was 47. He was 47 years old. The patient was from Udumalai. While we went and saw the patient, he was already admitted in the hospital for the past 1 month. So we initially took an assessment while asking the attendant of when we met the patient, he was already admitted in the hospital for the past 1 month. So initially we took an assessment. While asking the attender, we initially asked what was the reason for his admission in the hospital. So she told initially he had difficulty to eat. He didn't even feel, he was not at all hungry at all. So initially they had some problem in the GI tract. So they went in their district, they went to an hospital and took an ultrasound of abdomen, but that was normal. So then later on, they thought it was normal, and then later on he had weakness in his leg and he had difficulty in hearing on the left side he had difficulty hearing, and then he had weakness in the leg. So they came to the hospital and then they took an MRI. In the MRI they found that he had a tumor, he had a glomus tumor in the left he had a left glomus tumor with brainstem compression. So glomus tumor is a tumor that arises from the glomus body. The glomus body is situated at the base of the skull near the temporal bone. So as if it is, the tumor is near the temporal bone, it compresses the nerves of the vestibular nerves, and he had hearing trouble. So he has undergone a surgery. They did craniotomy plus tumor excision has been done to the patient. So he was undergoing rehabilitation for a month. So this is about the intro. So let me start the assessment. So chief complaint, I already told you the chief complaint. The chief complaint was unable to eat, weakness in his limb. The problems that he was having right now after the surgery was difficulty in walking, balance. He had weakness in the left leg and upper limb and lower limb. Both upper limb and lower limb left side he had weakness. So that was his problem list. So coming to the subjective examination, present history was same. Weakness in the limb. Past history, had hypertension for 2 years and was on medication. Coming to surgical history, the surgical history was left craniotomy plus tumor excision was his surgical history. Medical history, had taken hypertensive drugs. He's been taking hypertensive drugs for the past 2 years. The personal history, while asking the personal history, the attendant told me that he had an habit of smoking before 2 years, but he had quit smoking. So this is all about the subjective examination. So coming to the objective examination, on observation, his body build was ectomorphic, but initially before the surgery was a little mesomorphic, but now he has become ectomorphic. Gait of the patient was unable to identify because he was supine. So posture is also unable to identify. External appliances, he had NG tube, which is nasogastric tube for food, and he had been done tracheostomy. On palpation, temperature was normal. There was no swelling or edema. Everything was normal. Tenderness was also not present. So on examination, while examining his muscle tone, right side, the tone in the right limb, upper limb and lower limb was normal, but it was flaccid in the left side. Both upper limb and lower limb was flaccid. So coming to the muscle power, is right side the muscle power was normal, but in the left side the muscle power was little less. It was about grade 2. Range of motion was not at all present in left side. In right side it was normal, to some extent it was normal. So coming to the diagnosis is left glomus tumor with brainstem compression. So is the long-term goal of the patient was to improve balance and walk independently. Short-term goal was to do aerial activities, normal aerial activities. As he was on tracheostomy, he was unable to talk. So while we are giving treatment, he used to only talk to us through sign languages. He used to write. He had his memory was good, so he used to write us all that he wants. We'll ask him whether if he wants a song, he'll write us the song that he wants. So the treatment that we was giving is Initially, we were giving him passive movements and tilt table. So now when we went for the treatment, we gave him passive movements for upper right limb and left upper limb and lower limb, and active assisted movements for